So hello and welcome back to Unacademy. Let's quick NEET PG. Myself, Dr. Muskan Chaudhary, and we'll now cover the question answers for that of the amoeba and the free living amoebas that we have read. So starting with Unacademy. Unacademy is India's largest learning platform where we get access to both the live and the recorded sessions and learning from the India's topmost educators competing in the live T&Ds and with printed and digital notes assessing the QBank 725,000 starting on the device of our choice. And icon subscriptions and Academy and Prep has come together where we get access to clinical integrated essentials, video lecture QBanks, rapid revision snapshots, dream notes, and QBanks with competitive TNDs. Plus, category for 2 years it is around 36,000 and 58,500 for 2 years for iconic. And do use my code that is Muskan 10 to get 10% of the discount with 25,000 MCQs based on latest examination pattern, detailed explanations, special class features includes live interaction. We can do the polling for the learners. Raise a hand and ask your doubt. Never miss a class because we'll get the notification from the same. Download the lecture notes, get access to recorded sessions, and from anytime and anywhere. Uh, Target NEET PG batches that is having the topmost educators for the clinical integrated approach and the live and the recorded sessions with 24-month, 4-month subscription is totally free. 12-month, 2 month is totally free, and the 6 month, 1 month is totally free. FMG batches for the 6 months with FMG GTs, interactive sessions, Q banks from the Unacademy. Now we'll start with the question answers with that of the and Amoeba. Yes. Now, starting with the first question, all are true about the Amoeba histolytica except that stool trophozoites are essential for the diagnosis. Mostly 85% are asymptomatic, causes disease in the brain and causes disease in the liver. So, which of the following statement is not true? Yes. So, which of the following statement is not true regarding the Amoeba histolytica? So, take 10 to 15 seconds and let me know the answer. Yes. So the following statement, or each of the following statement, we read about the stool trophozoites are essential for the diagnosis. The stool trophozoites is not essential for the diagnosis, but we take around 3 stool samples on the 3 consecutive days, and we check for the trophozoite and the cyst form. If trophozoite is formed T for T, we remember that it is present in the active state, and the cyst form that is present is showing us about the carrier state, but they are not always present. They are intermittently shedded along in the stool, not continuously. So it is not essential for the diagnosis. For the essential diagnosis, we either go for the PCR or the lectin antigen, that is the adenosine antigens, which helps in the addition of the ant amoeba histolytica to the GIT mucosa. We have the clinical symptoms that is mostly asymptomatic around 19-95%, 85 to 95%. The second most common is the amoebic dysentery, then and the liver amoebiasis. And apart from this, they can cause the disease that is the liver amoebiasis, and we get the anchovy sauce pus. And asymptomatic cases are most common, and they can extend up to that of the brain. So that is a stool trophozoites are not essential for the diagnosis of that of the ant amoeba histolytic. Now moving to the next one, the violence factor that is responsible for the adherence of the ant amoeba histolytica to that of the intestinal mucosa is inophore lipoprotein, amoeba lactin, phosphatase, or the proteinase. Yes, what is the answer now? The valence factor, that is the principal valence factor that is responsible for the pathogenicity, is the amoebic lectin, that is a lectin antigens which helps in the addition to that of the intestine. And what is the most common site that is involved? That is the large intestine, and that is the cecum followed by the sigmoid colon. Now, the most common site for the amoeba is sigmoid colon, transverse colon, cecum, or hepatic flexure. The most common site for the amoebiasis is the most common site that is in the large intestine, and that is cecum followed by the sigmoid colon. Although the whole of the large intestine may be involved, and that is cecum is the most common site for sigmoid colon. And what do we get? We get the flask shaped ulcer. We get the flask shaped ulcer with broad base, with broad base and a narrow neck in around 10 to 15% of the cases, because most of the cases are asymptomatic. Investigation of the choice for the amoebiasis is ELISA, colonoscopy, microscopy, or microscopy with ELISA. Yes, so investigation of the choice. Now, investigation of the choice is the microscopy with that of the ELISA. Now, alone microscopy is sensitive only up to that of the 25%, but we take three stool samples on 3 consecutive days. And if trophozoite is present, this will indicate the active state, and the cyst will present the chronic carrier state. It will indicate the carrier state, and along with that of the ELISA to detect the lectin antigen, that is a principal valence factor for the amoebiasis. And with that of the microscopy and ELISA is the investigation of the choice for that of the amoebiasis. Microscopy is poorly sensitive, but the sensitivity increases up to 80% if we take 3 consecutive stool samples and we check for that of the trophozoite and the quadrinucleate cyst. Now, ELISA that we are using to detect the lactin antigen, amoeboid lactin antigen, that is 170 kD. Apart from that, we use the polyxenic culture and the exenic culture for the laboratory diagnosis for that of the amoebic dysentery. Now, number of the nucleus that is present in a mature cyst of Amoeba histolytica is 1, 2, 4, or 8. Yes, what is the answer now? Number of nuclei that is present in the mature cyst of the Amoeba histolytica is 4, and in that of the Amoeba, this E. coli, the what is the number of cysts that is present is 8. Now, most common cause of the dysentery in the adults is Cryptoparvum, Giardia, Strongyloids, or Amoeba histolytica. Most common, we have the agents for that of the dysentery. We have the agents for that of the dysentery. Now, the most common is the ant Amoeba histolytica, that is the commonest cause of the dysentery in the men. Other agents we have in that of the bacteria, which is causing the dysentery, that is the Shigella. We have the Campylobacter. We have the Vibrio parahemolyticus. They can also cause the dysentery. And then we have some parasites. One, we had the Entamoeba that is the most common, and we have the Schistosomniasis, we have the Trichura, and the Balantidia coli. Treatment given to entomycist carrier is metronidazole, diloxine or the paramomycin, nitazoxanide. Now here we are talking about the carriers. Although the drug of the choice is what the metronidazole and the tinidazole, that is the drug of the choice for that of the antihistolytica, but we are talking about the carriers. For the carriers, we give the luminal agents. We give the luminal agents, that is the paromomycin or the idoquinol, that are given to the asymptomatic carriers, because asymptomatic carriers, they have the risk of developing the colitis and the liver abscess in the future, so we have to treat that as well. So asymptomatic carriers or the risk factors, people who may be at the risk, are given the paramycin. Largest protozoa is Entamoeba, Balantidium coli, E. coli, or the Plasmodium. Yeah, hi doctor. Yes, so what is the answer? The largest protozoa is the largest protozoa is Balantidia coli, and it is only ciliated protozoa that is pathogenic to that of the humans. Alright, it belongs to Celiophora, and it is the Balantidia coli, which is the only ciliated pathogenic protozoa to that of the human, and it is the largest protozoa. And histolytica, true statement is it is mostly asymptomatic, differentiated morphologically from the disper, antigenically different from the disper, or spreads by the ingestion of the infectious cyst. So the true statement is Yes, so which of the following is the true statement? Now they are mostly asymptomatic, not symptomatic is a false statement. They cannot be differentiated morphologically from that of the non-pathogenic, but they can be differentiated on the basis of the presence of the lectin PCR and the presence of the RBCs, but not morphologically. They are similar, antimal histolytic and other non-pathogenic, so they cannot be differentiated. That is morphologically. Antigenically, they are different because they have the lectin antigen that is present in the Amoeba histolytica, which helps in the addition to that of the intestine, and they spreads by the ingestion of the infectious agent. This is also the true statement. So they can be differentiated on the basis of the lectin antigen, on the basis of the RBCs that are present only engulfed by the pseudopores in that of the Entamoeba histolytica, by the PCR, and by the isoenzymes by the zymodeme study. A patient presents with the lower GIT bleed and sigmoidoscopy shows the ulcers in the sigmoid. Biopsy from this area shows the flask-shaped ulcers. Which of the following is the most appropriate treatment? That is the IV ceftriaxone, IV MTZ, IV steroids, and the sulfasalazine and the hydrocortisone enemas. Now the question is saying that a patient presented with the GI bleed with the typical flask-shaped ulcer, that is the having the broad base with that of the narrow neck, which is classically present in ant amoeba histolytica. And what is the most common site that is involved is cecum, followed by the sigmoid colon, and they will present with the flask-shaped ulcers. Human is the only host. They have the single host, that is the human, and the treatment that we give is the tinidazole or the metronidazole. Which of the following statement is false? The presence of the ingested erythrocytes is seen only in the Anamoeba histolytica. Young adults, male of low socioeconomic status, are most commonly affected by the invasive amoebiasis. Low iron contact in the diet predisposed to the invasive amoebiasis. The pathogenic and the non-pathogenic strains of the histolytica can be differentiated by the electrophoretic studies of the zymodems. Yes, so which of the following statement is false? Will come to each of the one. The presence of the ingested erythrocyte is seen only in antihistamine is a true statement because it is a feature of the antihistolytica that by pseudopores they engulf the RBC, which is present in that inside that of the antihistolytica, and it is seen only in the antihistolytica. Now, young adults and the children of that of the low socioeconomic status with poor hygiene, they are most commonly affected, and because it is because the root is what the feco-oral root. Feco-oral root, that is the root of the infection. And transmission, low iron content, there is no correlation with that of the iron content with that of the diet that's predisposed to the invasive amoebiasis. This is a false statement. The pathogenic and non-pathogenic can be differentiated on the basis of the lectin antigen, which is present only in the Amoeba histolytica, on the basis of the RBCs that is engulfed only by the Amoeba histolytica, or by the zymodine study for the isoenzyme study of the Amoeba histolytica. True about the Amoeba colitis, it is caused by the Amoeba histolytica, contains 8 nucleus in the cyst, flask-shaped ulcers are present, and cecum is the most commonly affected and is pre-malignant. Yes, so the true statement about the Amoeba colitis is now, true statement, it is caused by the antivirus. This is true. Cyst contains the 4 nuclei. It is in the E. coli cyst, that is the cyst are present around 8. Flask-shaped ulcers are present. This is also a true statement. Flask-shaped ulcers with the broad base and the narrow neck is a classically present where in the Antihistolytica cecum followed by the sigmoid colon is the most commonly affected area because it is large intestine, that is the habitat for that of the Antihistolytica trophozoite where they form the colonies, and it is a pre-malignant condition. No, it is not. So A, C, and D are the true options. Now, invasive amoebiasis can be best diagnosed by the ELISA, countercurrent immunoelectrophoresis, indirect heme glutination test, and the CFT. Guess what is the answer? The invasive amoebiasis can be best diagnosed by the ELISA, that is the most sensitive and the specific one for that is the ELISA test. Now, acute meningoencephalitis caused by the acanthamoeba, amoeba, Naegleria, meningococcus, or the Balmutia. We have the Acanthamoeba and Naegleria, that is they are what they are free, and the Balamute, that is a free living amoebas. Okay, so we know that the Naegleria fowleri is responsible for causing the primary amoebic meningoencephalitis. Palamute also causes the amoebic meningoencephalitis, and Acanthamoeba they causes the granulomatous encephalitis. Okay, that causes the granulomatous amoebic encephalitis. Now, Naegleria fowleri, that is also known as the brain-eating amoeba, that is also known as the brain-eating amoeba, and it is the stagnant water and the soil that is the root of the transmission. And the person who is swimming the trophozoite form will transmit to that of the brain through the cubriform plate, and it is highly fatal. It is highly fatal and seen in the immunocompetent person, highly fatal seen in that of the temperate areas, and there is no treatment till now. All right, so that is the acute meningoencephalitis that is caused by the Naegleria fowleri. A patient following the use of the contact lens developed the corneal ulcers and symptoms of the conjunctivitis. Saline mount preparation of the corneal scraping shows the polygonal cyst, which should be the what should be the probable diagnosis? Acanthamoeba, Naglieri, Entamoeba, or Giardia. Yes, what is the answer? Now, patient is having the history of using the contact lens and developing the contact lens ulcers and symptoms of the conjunctivitis. Corneal scraping shows the polygonal cyst, sorry, what should be the probable diagnosis? Now, this is hinting towards the uh, acanthamoeba keratitis that is associated with the corneal injuries complicated by the exposure to that of the water and the soil. And we have the risk factors, that is the extent used of that of the corneal lens, or the breach in the hygiene, or swimming with the contact lens, or the swimming with the contact lens, or the use of the homemade solutions for the lenses, or use of the, that is we are compromising with the hygiene of the lens and the cornea, or swimming with the lens and wearing the lens for a long period of the time, that is the acanthamoeba amoeba keratitis presenting with the corneal ulcer and the conjunctivitis. Acute primary meningoencephalitis, which of the following is the true statement? That meningitis is caused by the acanthamoeba amoeba species is acute in nature, diagnosed by demonstration of trophozoite, caused by the fecal-oral route, and more common in the tropical culture. Yes, so which of the following statement is true regarding the PAM, that is the primary amoebic meningoencephalitis? We have three free living amoeba. One is the Naglieri, we have the Acanthamoeba and the Balamuthia. PAM is caused by the Naglieri fovri, and Acanthamoeba, that is caused responsible for granulomatous encephalitis, and then we have the Malamuthia that also causes the meningoencephalitis. So, meningitis caused by the cancer species is acute in nature, or diagnosis by demonstration of trophozoite in the CSF, caused by the fecal-oral transmission, or more common in the tropical culture. So, which of one is true? Now, coming to each of the one. Now, PAM, that is caused by the Naglieri, more common in the temperate areas, not in the tropical. So it's wrong, caused by not by the fecal-oral transmission but by the water and swimming in the water. Then it is a trophozoite form that is transmitted to a cribriform plate to that of the brain and having the CNS manifestation. Demonstration is true in the CSF. We do the wet mount to check for the trophozoite form, and meningitis that is caused by the Canthamoeba is granulomatous type, which is chronic in nature, while primary amoebic that is a suppurative and the acute one. A 30-year-old patient presented with the feature of acute meningoencephalitis in the casualty. His CSF on the wet mount microscopy reveals the motile unicellular microorganism. The most likely organism is Naglieri, Acanthamoeba, or Entamoeba histolytica, or Trypanosoma cruzi. Yes, what is the answer? Now, the question is talking about the acute meningoencephalitis. And on the CSF, we are seeing the motile organism, that is a motile trophozoite. We are talking about and the acute. Now, the acanthamoeba, that is again free living, but it is not an acute. It is a granulomatous and encephalitis, which is not an acute condition. What will the answer? Talking about the PAM, that is a primary meningoencephalitis, that is a Naegeli fowleri. And it is one more difference is there that acanthamoeba is a chronic one that is seen in the immunocompromised, and the Naegeli that is seen in the immunocompetent people presenting with the PAM, and it is highly fatal. Patient dies in 8 to 10 days, and there is no treatment that we know. For the diagnosis, we go for the CSF wet mount, where we see the trophozoite motile form, motile trophozoite of that of the this Naegeli. Now, which of the following is not a neuroparasite? That is a Taenia solium, acanthamoeba, Naegeli, or the Trichinella spiralis. Yes, what is the answer? Which of the following is not a neuroparasite, that is not involving the CNS? Yes, very true. The answer is the Trichinella spiralis. Now, Taenia solium that presents with the neurocysticercosis, where CNS manifestations are there. Acanthamoeba is responsible for causing the granulomatous encephalitis. Then we have the Naegeli, that is primary amoebic meningoencephalitis involving the CNS. And Trichinella spiralis, the main manifestations that are the intestinal system and the musculoskeletal system are involved rather than the CNS. Parasitic encephalitis is caused by the Naegeli, Acanthamoeba, Balamuthia, or Gnatstoma. Parasitic encephalitis is caused by. Now we have the list of the parasitic encephalitis. More than one option is true in this one. So we have the protozoal parasites that is involving that we have free living. We have already seen acanth amoeba. Then we have the Naegeli fowleri. Then we have the Balamuthia. Then we have the and Amoeba histolytica, which can also involve the brain. And we have the plasmodium. Then we have the trypanosoma cruzi and the trypanosoma brucei, and we have the toxoplasma gondii. So these are the protozoa that are responsible for causing the encephalitis. Apart from this, we also do have the helminths, that we have the echinococcus granulosus, we have the cystosoma, we have the Taenia solium, we have the Toxocara species that are involving the CNS causing the encephalitis. So they are caused by the Naegeli, Acanthamoeba, Balamuthia, and Gnatosoma. Yes. Girl visits her friend's village, develops nasal discharge with the meningitis, and dies within 5 days. Organism that is responsible is Naegeli fowleri, Acanth amoeba, Toxoplasma, or the Falciparum. Yes, pretty simple one. Now, a girl that is visiting with acute symptoms of the nasal discharge, with that of the meningitis, the most important thing that is so fatal that the person is dying within 5 days. Within 5 days, that is indicating acanthamoeba can't be possible because they are responsible for granulomatous, and they are chronic cases that they will take some time for the symptoms to appear, but Naglifoldry is responsible for the primary amoebic meningoencephalitis, which is an acute condition which is highly fatal and seen with the symptoms of that of the nasal discharge and the meningitis after swimming in the after having the swimming in the water, and the trophozoite that is entering into the brain through the cribriform plate and showing the CNS manifestation. So, and treatment is not yet available for that of the Naglieri. For the Plasmodium falciparum and the Toxoplasma, the person will not die just within the 5 days of that of the visiting the friend's village. That it will only so acute condition and highest mortality rate that is seen in the Naglieri fowlery, and is so fatal that within 8 to 10 days the person will die. Seen where? It is seen in the temperate areas. Alright, and what is the infective form? It is the trophozoite form, amoeboid, or the flagellate form, that is the infective form, and enters through the nasal cavity to that reaches up to the brain. Okay, so that was it. We covered the Histolytica, we covered the free living amoebas, and we'll cover the next rest of the parasites in the next sessions. So please do use my code, that is Muskan10, and keep updated with the sessions, and do like, share, and comment. Press the bell icon so that you'll get the notification for the upcoming sessions from the Unacademy. And I'll see you soon in the next class.